You know, friends, if you died and went to heaven, and you had to see a doctor once you got to heaven, they say that Dr. Lee Aaron Keneally would be the doctor you saw. Joining me today is a most amazing physician, unlike many physicians, although much like physicians I have within the content of this show. Dr. Keneally believes that we are largely responsible for our good health, and then we're largely responsible for our bad health. Welcome to the show, and thank you so much for joining us. This South Coast Medical, dare we say, plaza is amazing. This is almost 20,000 square feet of office, and you came in to be on our show, and I'm really grateful for that. Out in the Los Angeles area, Irving area of California is where your office is. After medical school, Dr. Keneally, where did you go so right? Because you went through the same 8, 12 years everyone does in medical school. When did the light bulb go on and you say, you know what, I think we could have prevented that heart attack?
Well, it's interesting, Doug. Great, wonderful. It's great to be here. I love telling people about things that they don't know and things that they should know. And we all are on this journey uncovering many, many, many different paths. But for me, as a physician, I did go to medical school, a conventional medical school, and did training at a great place. But then as I was seeing patients would bring in to me papers on like DHEA, and I'm like, I mean, this was 20 years ago, okay? When now everybody knows about DHEA. And so I would say, well, let me see, let me take a look at this. And so I started reading it, and I remember saying this, gosh, this sounds like amazing stuff. I need to know more about this. So back then we didn't have the computer availability and all the information that's available today. But I started calling the places that would sell this stuff, and actually it was basically by compounding pharmacies. And so I thought, God, this is an amazing thing. Well, that led to another avenue, and now I've probably been on 1,000 avenues, other than my own personal experience seeing patients and my own personal battle with illness.
Those battles, those avenues are what we're going to be talking about today, because she has built a medical center out in California, and you're all welcome to inquire. We'll put up a website that is nothing short of amazing. We'll be right back. South Coast Medical Center out in the Irving area of California is, or Irvine, I'm sorry. In Texas we have Irvine, and in California they have Irvine.
That's right.
South Coast Plaza, South Coast Medical Center is a center that I understand you built. In having a bite with you last night, I learned a lot about you. Number one, our good friend Frank Jordan thinks you hung the moon. And after having a bite with you last night, I think our good friend is correct. Your goal with thousands of patients that come through the clinic, and it's a multidisciplinary clinic, and we'll explain that in a minute, is to educate them, care.
That's right.
Have them understand the cause, the etiology of their health problems. It's one thing to hand a patient a diflucan and say, see, that was a yeast infection. It's a whole other thing to say, now you're going to come in Saturday morning, and we're going to teach you how not to get those anymore. And so I really like your approach. Yes, you've built a big center there, but you're in love with every one of the patients that walks in, and I think that makes you unique. Following medical school, did you find yourself the hamster on the treadmill? Prescription for this. Doctor, there's someone online too that has migraine, Furanyl. There's someone online, you know, and you're just writing. And did you step out of that madness and begin to do the one patient at a time?
Well, I've always done the one patient at a time, Doug. I really did, even from the beginning, because I didn't think that I would ever get to know and understand that patient if I didn't sit down and really analyze why they are here to see me and develop a relationship. Because the patient knows what's wrong with them. They know. I don't know. They know. And so if you sit down and take the time in that initial visit to know that patient, and not just to know their complaints, but know their way of life, their family, what they do, how they sleep, every aspect of their life, and then you can help them the best. But I did, yes, I was trained to give medications and write prescriptions, but I really early on thought about, okay, what is good is this going to do my patient? How is this going to help my patient? Sure, it's going to give that instantaneous fix for the short term, but what is it going to do for them long term? So early on, I have to say, even though I may have given prescriptions because that's what I was taught in medical school, but I learned that, okay, this is not what's going to really make them feel better in the long run.
Sometimes prescriptive medicine is necessary. I say that on this show. If I went to see a doctor and my blood pressure is 400 over 300, I'm going on a drug. But only until I can figure out why. Did I move into a moldy home? Has there been a lot of stress in my life, etc.? Let's talk a little bit about your philosophies. We talked a little bit last night about mercury amalgam, and you just lit up like a Christmas tree. That's obviously a hot button for you. Mercury amalgam is something we need to be cautious of. Is that kind of your contention?
Well, look at what's going on now, Doug, okay? Do they even use mercury amalgams? If they were so good, why aren't we still doing them? Obviously, but the ADA, unfortunately, has not completely embraced the fact that mercury is dangerous to your mouth and to your body. There's probably nothing more dangerous than mercury. Mercury is one of probably the most toxic heavy metal on the planet. Yes, there's cadmium, there's lead, but mercury probably tops the list in toxicity. And we're talking what symptoms? You can have everything from headache to dizziness to abdominal pain to candida to high blood pressure, neurological problems. I mean, there's 1,000 different symptoms associated with heavy metal intoxication. And people don't realize that every one of your teeth correspond to a body part. Just like you have on the bottom of your feet, your hands, you have every one of your part of your feet correspond to a body part. Well, every one of your teeth. And actually, I'm not sure if you know this, and because you're very, very knowledgeable, Doug, about things, but they've actually correlated that patients who have a dental infection, and they've done basically thermography issues and found that this was what was causing their breast cancer. So dental, not only dental amalgams are a problem, but dental disease, infection. It's amazing. Oral cancer has increased so much just in the last year, oral cancer. And one of our friends, this is a very interesting story, was talking to me. He had taken his daughter to the dentist in Newport Beach, California. And he was telling the father that 50% of the teenagers in Newport Beach have sexually transmitted diseases in their mouth, Doug.
Okay, wait a minute. 50% of teenagers.
So, yes, 50% STDs, so that's HPV, and that's herpes, and chlamydia and other viruses. Now, we all have viruses and we all coexist with viruses, but as you know, viruses predispose us to cancer. So, and weaken the immune system. So,
where does, I heard the C word, I heard Candida. Where does that fit into your lectures? I know you travel a lot and lecture a lot, and you've really gained prominence in that area. Candida albicans, just a little yeast, budding, yeast. Is it pathogenic? Does it give off a poison, and can it cause human misery?
Well, Candida, if there are women listening, and or guys, okay, what is Candida? Candida in most people, and symptomatically, and when you go to the physician and you're going to talk about a vaginal yeast infection, you have guys who have jock itch, you have maybe rashes on your body, unexplained rashes, because people don't understand that that's usually yeast. In your mouth, if you stick out your tongue and your tongue is coated with white, you most likely have Candida. Now we all coexist with organisms, viruses, bacteria, fungi, and parasites. But Candida, and there are multiple species, and as we were talking, Doug, I've got a quantity of 400,000 species supposedly. But you're right. Unfortunately, Candida, when becomes a problem of overgrowth, if you've taken antibiotics once, you probably have Candida. If you use birth control pills, you probably have Candida. If you use steroids, if you eat sugar all the time, if you have taken any medications on a chronic basis, even chemotherapy, your body's going to be flourishing in Candida. But why are these little critters so bad? They're bad because they produce mycotoxins. Myco is the word for fungus, and obviously a toxin. And what they produce is a chemical called acetaldehyde. And acetaldehyde actually makes several different acids. Well, these acids basically pollute the body and basically cause killing of the cell. So it's a very, very serious condition.
And it's a vicious cycle for the patient. And this is why I like the South Coast Medical Center, folks. When you go there, this is how medical centers should all become within the next 10 years. I would love to see this happen. Okay, we're going to give you some medicines and some supplements to help you get better. Don't leave us. Learn why this continues to happen to you. They have a whole bunch. They have a biological dentist there who can remove amalgam. They have other therapists and practitioners. But what about diet? How do you keep your immune system up? We'll be right back with Dr. Kaufmann. Dr. Lee Erin Keneally joins us today, the South Coast Medical Center. She is the medical advisor out there of that center for new medicine. And getting to the source of the symptoms. For new medicine, explain that, because that's what your center is. And then getting to the source of the symptoms, dare I say, who would come up with that brilliant name? Know the cause. But that's really what you profess there, is understanding the root cause. And what is the new medicine?
Well, the new medicine is integrating anything that we have done conventionally, and that could be obviously routine lab tests, that could be medicine, as you said earlier. I do use medication. If you come in with a blood pressure of 200 over 100, I'm not going to use some natural ingredient to bring down the blood pressure. Or you have diabetes and the blood sugar is through the roof and you're almost in a coma, we have to use medication. Yes, but then we got to figure out, okay, why, where, when, and how did you get here with this problem? So that will take me a couple weeks to a month, depending on how compliant my patient's going to be and how good my recommendations are. But we try to find the root cause and why are you in this situation to begin with? And new medicine, interestingly enough, conventional medicine only gets you so far with medications. You can only accomplish so much. But new medicine uses all kinds of other treatments. You may use nutritional supplements, you may use energy treatments, you may use acupuncture, you may use,
colonics.
Really
clean
you
yourself
might
out,
use emotional freedom technique to emotionally help balance somebody. You may use herbs. You may use IVs. We use a whole different set of procedures and recommendations that are not just medicine, because medicine is what I found. We have to face it, medicines are toxins, okay? Yes, they can be beneficial in the emergency situation. I tell people, in the United States of America, we are phenomenal at handling a crisis, no question. But for the chronic illness, we are failing miserably. I mean, look at our cancer rates. In 1964, cancer was 1 in 214, Doug. Now it's 1 in 3 women and 1 in 3 men and 1 in 2 women. This is very, very serious. Heart disease, has it decreased? No. How many billions and billions of dollars have we spent on research to find out the causes of these diseases, and really haven't gotten where we should be?
Well, stereotypically, I look at Race for the Cure. Good idea, good intentions, but I'm telling you, after 20 years of being in business, if the rate of breast cancer was going like this, I salute. Hats off, I commend you guys. Here's my donation. I'll even buy your pink and white M&Ms. I'll go that far. But with the breast cancer incident going like this, and more money going into organizations like the American Cancer, American Heart, American Lung, you're right. It seems to me that we're hamsters. We, the patients, are the hamsters on the treadmill. Which doctor shall I see? Well, he'll just put me on a medicine. Well, then go see a psychiatrist. Well, he'll just put me on a medicine. We've got, folks, she hit the nail right on the head. Dr. Keneally said it best, and that is, you know what's wrong with you. It's your physiology. You're going to turn it over to a second party whose job it is, by the insurance company, to see 55 of you a day. You're going to get 2.4 more drugs. And that's where a center like the South Coast Medical Center puts the brakes on and says, howdy, shake my hand, sit down, let your heart out. What's wrong? How long has it been going on? Do you live in a moldy home? Can I see your toenails? The one thing a doctor should ask a patient to take off is not your shirt so they can listen to your ticker. It's your shoes so they can see onychomycosis, your toenails, see if you have a fungal condition. I wonder how this Candida, how aflatoxin B1, how T2 toxins, mycotoxins, and so forth affect people from head to toe. Some of them are neurotoxic. Today we see Alzheimer's and Parkinson's and senile dementia. Do you ever stop, do you lay in bed like I do at night and think, I wonder how many people are impacted by these mycotoxins and fungal diseases and parasites that the medical community has no earthly idea they are?
Well, the medical community knows, they just don't
know
how to deal with it. And you're right, Candida, probably 80 to 90% of the population has it. Some people have it, and we all have it in varying degrees, but you were talking about symptoms. The symptoms are myriad, okay? You could have abdominal bloating, you could have gas, you could have dizziness, you could have headache, you can have depression, you can have hormonal dysfunction, you can have cancer, you can have extreme fatigue, sleep disorders. So Candida manifests itself in a myriad of symptoms. And I have in my office, I use a great little kind of questionnaire worksheet that I basically say, fill this out, and then, because a patient a lot of times can't always convey all of their symptoms to you, so I have them fill out and you can pretty much know. And a little test, I told a patient the other day, because it's interesting, she came in, I guess it was just right before I came here, and she goes, Dr. Keneally, I think that I have fungus. And I said, really? And she's really a healthy lady, and I said, okay, so why do you think that? She goes, well, I just don't feel right, and my tongue is white. And I said, okay, so I examined her, and I said, look, there's a simple little test. I'm going to do a blood test, but there's a simple little test you can do when you wake up first thing in the morning, take your saliva, put it in a glass, and watch it over the next 30 minutes. And I said, so if you see the saliva kind of drizzle down, kind of like a jellyfish, or it gets cloudy, and it falls down to the bottom over 30 minutes, then you know that you have...
Are you saying, Dr. Keneally, spit into a glass half filled with
water
and kind of watch it?
And watch it over the next 30 minutes.
And what happens?
And after, you watch it, I tell people go and visit like every 10 minutes. Visit your saliva in the morning. Oh, what a concept. Anyway, but the saliva, it basically trickles down, like the, what is
jellyfish.
Jellyfish, and what's the other little, a sea creature that also has the kind of the
pretty sea anemone.
Sea anemone, yes. Like basically it kind of trickles down, okay, and you can see like the tentacles of the saliva drizzling. Or you'll see a cloudiness, okay, like maybe in the center or the lower, or if it settles down all the way to the bottom, you know that you probably have Candida. But people just have to, if they just take a moment in the daytime, look at their tongue. If their tongue is coated with, it's something I do with every single patient. Most doctors, when they're looking at patients' mouths, they're really looking at their throat, or they're not really looking at their tongue. Yeah. But I learned from a Chinese guy, I have this book called Fingernail and Tongue Diagnosis. And it's amazing what you can find. And I actually have it in every exam room so I can show patients what the different things, and they start looking, Dr. Keneally, that's just like me. This one's right, because their fingernails, ridges, or spoon-shaped, or all kinds of different shapes.
See, most medical doctors make it through medical school, and that's putting the brake on. We're done. We now have a license to see patients, and we're just going to write, do exactly what the pharmaceutical industry asks us to do. Every once in a while, you get a Dr. Keneally, and of course, we love doctors like her on this show, that ask the question that these 180 IQ, 190 IQ physicians don't. You and I do all the time. And it's a one-word question. Why? Why do I have this heartburn? Why do I have migraine headaches? We'll be right back with more. Dr. Lee Erin Keneally has been with us today. She is the medical advisor at the South Coast Medical Center for New Medicine. We discussed what that new medicine meant. Out of necessity was born a whole sidebar to her practice, and it is a sizable practice now. And that is a whole line of products, perfectly healthy products. Tell us a little bit about these.
Well, first of all, we have the mega greens. As you know, we've talked before how people don't eat vegetables, and people's body tends to be acidic, and we don't want our bodies to be acidic. We want them to be alkaline. So pills for people who don't want to take the powder. I personally use the powder, and my husband, I force him to do that too. And so I usually do that, and it's over 40 different vegetables, and they're great for the nutrition as well as the alkalinity. People who have GERD, this is amazing product, absolutely amazing. If people take antacids, Zantac,
Sure, yeah.
Acifex, etc.
What's that called? Heartburn?
Ease.
Heartburn ease. I like
and it
that.
works in one day. Osteoplus, people who have osteoporosis, we have the calcium, the vitamin D, and K2, which is the newest vitamin to basically take the calcium out of your blood and put it in your bones.
Did you develop products around needs? In other words, you saw 100 women with osteoporosis and said, I'm going to do this. 100 people with GERD and said, I'm going to do this.
Well, not 100, more like thousands, because I've been doing this for 20 years, and I basically, out of necessity, develop things that...
Do you formulate these? Do you sit down with a chemist with a big brain and say, listen, I need something with X, Y, and Z in it?
No, usually I do my own research, and I keep up. I'm constantly reading, researching, going to conferences, getting the latest and greatest, and I usually do it myself. I always listen to other people and say, okay, what do you think? Take a look at this product. I have a phenomenal nutritionist on staff. She knows everything, and she's the most studied human being you could possibly imagine. She probably goes to a conference every weekend.
I don't know how you do all of this. Are these educational tapes that I see down here?
Yeah, well, every time I do a lecture, Doug, we do a DVD, because people, they want to go to the lecture and they miss it, but this is a great opportunity for them to recapture.
You know, I don't know how you do this. You are juggling with about 6 balls in the air. Me, I can do the sports page and click the TV at about the same time, but then I'm a guy, host of Know the Cause. We are humbled and blessed that you're here today with us. Thank you so much for the education.
Well, thank you for having me. It's great.
Total joy. I've heard a lot about you from Frank Jordan. Now I believe everything. Thank you, folks, for joining us today. I'll see you again tomorrow. Bye-bye. Let's talk on today's show about the endocrine system, that system which makes hormones inside our body. And there's all sorts of glands that make hormones, but there's all sorts of endocrinologists also. And an endocrinologist, I think, sometimes is a professional prescription man. You have diabetes, take this. My pancreas isn't right, take this. My thyroid's wrong, take thyroxine. And so Dr. Keneally joins me again today. Lee Erin Keneally is her name. She's all the way from the Los Angeles area in California. Thank you for coming back and being with us today. You're a little bit different. If you see a diabetic patient, you should have named this show. I've interviewed you before. Understanding the etiology, the root cause, is what your clinic, the South Coast Medical Center, the New Medicine Center, talks about. When you see a person with a 300 blood sugar, during the content of today's show, when you see a woman that comes into you just dripping wet, she's got mental aberrations, vaginal dryness, she's going through menopause, how are you different from any other board-certified doctor when it comes to endocrinology type diseases?
Yeah, for our listeners, Doug, this is a great topic and something that people, men and